Hi, I want to give you information about motivational interviewing basics or MI basics. We're going to talk about what is MI, the skills and strategies for MI, and how to elicit change talk. Let me ask you two questions first. How many of you have the same patient that comes over and over again for the same thing, for the same problem? As if all the information that was given to them, education or instruction from the doctor, was never followed. Or by you too. Second one is, what would you do for your patient if you're able to have them start thinking about making some changes in their lives? Now, I learn and apply MI at work, and through research for this topic, I learned more about it. Let's start it. What is MI? What is motivational interviewing? According to the most recent definition from Motivational Interviewing book, 3rd edition, by Miller and Rolnick in 2012, MI is the collaborative conversation style to strengthen a person's motivation and commitment for change. There's three approaches that's being used at the healthcare setting right now. First one is one directional approach, meaning we tell the patient what to do. The second one is following approach, meaning we have to be there for the patient. Now keep in mind, for following approach, change talk was never discussed, so it does take longer and it becomes too long after a while. Now the third one is motivational interviewing. It's a way for us to meet the patient where they are and help them and guide them where they want to be, using collaboration, evocation, and autonomy. Now there's three motivational interviewing spirits. The first one is collaboration versus confrontation. It's basically a clinician and a patient working together as a partner. The second one is evocation. It's basically drawing out ideas rather than imposing ideas. It's to help them start thinking about making some changes in their lives. Third one is autonomy versus authority. It's basically for us to recognize that the true power for change relies on the patient. Now that we know about MI, what is MI and what is MI spirit, let's move on to skills and strategies. Let's talk about strategies first. Strategies is basically accepting what the clients bring in non-judgmental way. We help them know what their absolute worth, knowing that the human being has a capacity for change. Second one is providing accurate empathy. Third one is supporting autonomy. And the fourth one is providing affirmation. Skills that we use for MI, we use OARS, counseling skill. The O stands for asking open-ended question. The A stands for affirmation. The R stands for reflection. And the S stands for summarizing. Now that we know skills and strategies for MI, let's talk about how to elicit change. Change talk. Definition of change talk is a statement by the clients revealing consideration, motivation, or commitment for change. When they start showing motivation for change, we provide them with support and guidance. How do we do this? We prepare them for change talk. Involve their own desire, ability, and reason, and their needs for change. We implemented it. Using their own way of commitment, activating it, and start taking steps for change. Now in conclusion, I hope you understand what MI is and able to learn skills and strategies to motivate patients for change based on their own motivation. MI is one of evidence-based practice being used as part of patient-centered care in most hospitals. I really believe we can use this approach rather than a traditional one-directional approach. MI promotes more collaboration between patient and clinician, empowering patient for change towards their personal well-being and goals. It actually reduces non-adherence and hospital costs. Thank you.